am Verna Edwards. I work with the Ministry of Health. I am the Chief Dangerous Drugs Inspector, and my work involves importation of controlled substances, narcotics, psychotropics, and precursor chemicals. Well, what we have is we have facilities that the drugs are not available as they should be, and so part of my work is to ensure that all facilities have the drugs, and the patients, when they do present the prescription, that they should be able to get it. My challenge is to advocate that all cancer patients should be able to access opioids and should be able to get pain relief and improve quality of life in their last few days with their family members. And also to be able to stay at home versus having to go into a facility to get pain therapy, which is one of the big problems, where rather than stay home, having the drug and be able to access it, they would have to travel maybe for miles to access the drug in a facility or a hospital. So I think that's the greatest part of this program, that your end-of-life care, would have been improved just having the drugs available, for you at home.
Okay, hello, I'm Rosa Buitrago. I work in Panama for the University of Panama. I work as a professor of pharmacology, and also I am professor of cancer pain management. Okay, even when we got a change in the laws that allow physicians to make recipes, prescriptions to patients on pain, we do not have enough opioids in our country. For instance, we have morphine, but we do not have other related medicines, and we do not have many people trained, many patients knowing what are their rights. For instance, there are international associations saying that every time a patient goes to the clinic, the pain must be evaluated, and this is evaluated blood pressure, heart rate, and some other vital signs. When I began to do this work like 4 years back, we had a regulation and a normative that was very restrictive in terms of which a physician could prescribe and how long they can prescribe for some medicines related to pain, relief pain. And also I have been doing an enormous amount of work related to teaching to pharmacists, teaching to physicians, teaching to patients, in order they can know what to do and when they need to do those things. Well, probably the key verb will be get engaged, because pain is everywhere. You probably are feeling now very well, but you don't know when are you going to be needing this kind of medication. You don't know when someone of your family, someone of your neighborhood will be needing those medications. So get engaged. Try to contact people in your country, and if you are going to provide help to Panama, definitely we need help in order to train more people, in order to give instructions to health authority how calculate the amount of these medications are needed for the almost 4 million people in Panama.
My name is Eva Duarte. I live in Guatemala and I work at the National Cancer Institute there. I'm the palliative care physician for the poorest patients that come to our hospital. My work there is trying to relieve their suffering, pain, physical pain, psychological pain, emotional and spiritual pain due to cancer. And the 50% or the 70% of our patients come in a very advanced stage. So most of our patients are palliative. That's why I'm interested in trying to facilitate the access and the availability of opioid analgesics for them. That's why I'm here. So the way I try to do this is standing on behalf of my patients and being their voice. And I am the only person that can advocate for them now, because I'm the only physician involved in this kind of work for adult patients. One of the best and one of the primary needs we have is to recruit more doctors that get involved in palliative care attention. We are only 4 palliative care doctors for the whole country in Guatemala. And that this is a huge need. As I said, advanced cancer is the most common diagnosis in cancer there. We need help making awareness on the rights for the patients. Many people think that having cancer is as synonymous of having pain. If patients know their rights, they will ask for pain relief. That is one of the things that we really need. We need to recruit more doctors, as I said. We need funds to keep more palliative care services going on to reach the people that lives really far away from the city. And we need medicines. We don't have oral morphine in Guatemala, and patients are paying high quantities of money for their medicines. We don't have low-cost oral opioids there. That's why I'm working here too.
I am Gabriel Madiye, the Chief Executive of Shepherd's Hospice, a service providing palliative care for HIV and cancer and other life patients suffering from life-threatening conditions in Freetown, Sierra Leone. Sierra Leone is West Africa. Before 2006, we had patients in severe pain with cancer, with HIV and other conditions, and we could not have them pain relief. You know, you just imagine how the family members were so much traumatized as a result of the excruciating pain that their loved ones had to go through. And even our staff were so demoralized. They have to sit near patients and can only offer Panadol or drugs that are non-opioid drugs, or likely weak opioids. You know, it was so demoralizing for them. We all thought there was a need to have a more efficient way of treating severe pain. I have a case of a lady who is Zainab. Zainab had breast cancer and all these years have had to live with severe pain until 2008 when we got opioid. Zainab got the first supply of opioid medication. You won't imagine how Zainab would go to the backyard garden and weed and then harvest her vegetables and bring and cook to eat with the husband. Yeah. And she is still alive. So palliative care or pain relief improves the quality of life and relieves family members of their agony and pain, because when your loved one is in pain, you are in pain too.